Hi, welcome to our channel of ignou audiobooks, Indira Gandhi National Open University, School of Social Sciences, SOSS, Master's Degree Programs, MA, in Psychology, MAPC, Second Year, MPCE 0 to 3 Interventions in Counseling, Block-1 Psychological Interventions, Major Modalities, Unit-4 Counseling Children, 4.0 Introduction, Child's Development, Its Meaning, Study, Research, and child counseling are some of the interesting and exciting areas in today's world. Researches about development have also been stimulated by the social pressure to better the life of children. While studying child development and counseling, certain questions arise in mind. In what way are children's home, school, and neighborhood experience the same today as they were in generation past, and in what way are they different? What perception children have of the world in general, and how is it different today? What is the role of heredity and environment on the development of children? The above are some of the important and central questions in regard to child development and counseling. In order to look into and to study child development and how to counsel children, the following three domains are to be considered, viz. I. Physical development, 2. Cognitive development, and 3. Environment and social development. Let us deal with each of these in detail. 1. Physical development. This comprises of changes in body size, proportion, and appearance, functioning of body system, brain development, perception, motor capacity, and psychical health. Special professional help is provided if there is any delay in any of the areas of physical development or any development which is not in accordance with the normal developmental schedule. 2. Cognitive development. This refers to a wide variety of thought processes and intellectual abilities, including attention, memory, academics and everyday knowledge, creativity, imagination, problem solving, etc. With the increase in age, the capabilities and capacities in regard to all the above areas also increase. However, there are children who do not show any increase but conspicuous stagnation or decrease in a few or many of these areas, and these disturbances obviously affect the growth and development of children. In such cases, professional consultation may be needed so as to help these children overcome such problems. Such problems may arise due to social factors or environmental factors, or in certain cases it could be due to hereditary factors too. The root cause of the problem is generally identified by the counselor, and counseling is carried on depending on the causative factors so identified. 3. Environmental and social development. It is the development of the emotional communication, self-understanding, ability to manage one's feelings, knowledge about other people, interpersonal skills, friendship, moral reasoning and behavior, which all develop as children start growing up from stage to stage. According to Erikson's psychosocial theory of development, the various stages of development are classified on the basis of social and emotional development. For instance, in the first year of life, the social and emotional development is indicated in the trust vs mistrust in the child. In the second stage, the social and emotional development is indicated in the development of initiative versus guilt. In the third stage, it is characterized by industry versus inferiority, and so on. And at the final adult stage, it is the ego integrity versus despair. At each stage of development, the problem and the conflicts that arise are resolved, and the individual moves on to the next stage of development, and so on. If at any of the stages of development the problems and conflicts are not resolved, the individual may develop all kinds of complexes, inferiority feelings, insecurities, low self-esteem, becomes unsocial, lacks decision-making power, etc. In all such cases, counseling will be required to both understand the causes and treat the same and bring the individual back to normal level. In this unit, we will be dealing with all these factors and also many of the childhood disorders which need counseling. 4.1 Objectives. After reading the following unit, you will be able to Define child development, explain the various problems related to different stages of development, describe the psychological issues underlying the problems, elucidate the techniques of counseling children for their betterment in life, explain in detail physical development, cognitive development, and environmental and social development, delineate the meaning, causal factors of learning disability, analyze the nature and characteristics of learning disorders, describe the techniques for helping children suffering from learning disability, elucidate the attention deficit hyperactivity disorder, ADHD, delineate the types of anxiety disorder, AD, and its treatment, and explain the general counseling techniques, counseling strategies, 4.2 children and disorders. According to the recent estimates, 17% to 22% of the children under age of 18 years meet the diagnostic criteria for one or more mental disorders. Of these, 11 to 14 million children, that is, at least half of them may be severely handicapped by this order, and half may have trouble coping with the demands of community, family, and school. Some behavioral disorders in childhood have long-term effect. Maladaptive behavior in childhood results from normal variations in rates of development. Early childhood experiences which are negative can also lead to inadequacy and inferiority. In adulthood, children who are unable to master academic work when their classmates are able to, it would indicate that these children are having some serious problem in learning. So the counselor must keep in mind that if these childhood problems are not solved, then there are chances that these children when grow up as adults may suffer from low self-esteem, depression, anxiety, inferiority complex, etc. and may also develop some or the other personality disorder in later years of life. Many of the untreated children are likely to progress into severely mentally ill adults. According to Jensen, 1990, the factors include prenatal psychopathology, family discord, divorce, low social economic status, child abuse, temperamental characteristics, and stressful experiences. Eglin et al., 1993, stated that abused children have very high rate of psychological problems and these children require counseling. As through counseling, many of these problems could be sorted out and thus when they grow old and become adults, they will have balanced personality and will be helpful for themselves, family and society. This chapter will focus on developmental problems of children and how these problems can be handled through various measures. Counseling, the most commonly known developmental problem faced by the children is LD, learning disability, attention deficit hyperactivity disorder, ADHD, anxiety disorder, AD, disorders such as enuresis, encopresis, sleepwalking, tics, autism, etc. 4.3 Learning disability, LD. LD is a kind of disorder where inadequate development may be manifested in language, speech, math, or in motor skill area. This may or may not be due to physiological or neurological defect. Most common subtype of learning disability is dyslexia, which is collectively known as reading-writing difficulty or vice versa. In LD, the children find difficulty in recognizing and reading comprehension. Often she is found markedly deficient in spelling as well as in reading. The learning disability, children are generally identified during the early years of childhood because of the apparent disparity between their expected academic achievement level and their actual academic performance in one or more subjects such as maths, English, Hindi, etc. These children have an average IQ and do not have emotional problems, nor do they seem to be lacking in motivation or cooperation. 4.3.1 Casual factors of learning disability. These disorders are a result of some sort of disability, immaturity, or deficiency limited to certain brain functions supportively mediating, as for example dyslexia is associated with failure of brain to develop in normally asymmetrical manner with respect to the right and left hemisphere. The portion of left hemisphere where language functioning is normally mediated, it is underdeveloped in many such cases. Some researchers have also indicated that learning disorder also develops because of genetic transmission. Learning disorder may be due to certain basic psychological processes within the individual. It may also be because of extrinsic factors like sensory impairment, emotional disturbances, cultural differences, and lack of educational opportunities, etc. 4.3.2 Nature and characteristic of learning disorder. The counselor must remember the following points before diagnosing learning disorder. In children, learning disabled children essentially suffer from serious learning problems for number of reasons. The problems and disorder are usually manifested by significant difficulties in the acquisition and use of languages, reading, writing, speaking, etc., reasoning of social skills, etc. They may show symptoms of hyperactivity, impulsivity, and most of them show symptoms of anxiety. Learning disorder in children is not apparent in the physical appearance. Learning disorder can occur with normal intelligence. Learning disorder children show significant educational discrepancy, i.e., a void gap between their learning potential and actual educational achievement, and they lack in mastering the academic part.
4.3.3 Techniques for helping learning disability. There are several specialized counseling techniques and approaches that have been involved by the counselors while working with the learning disabled children. Brief introductions of some of them are as follows. Behavior modification approach. In this approach, the counselor makes attempts to modify the behavior of LD children by reconstructing and reorganizing the environmental conditions, providing opportunities for modification and change in behavior. Using proper reinforcement, they help the LD children acquire desirable learning behavior. The other counseling techniques which a counselor uses for treating learning disorder includes token economy, positive reinforcement, timeout procedures, and other behavior modification techniques. Psychoanalytic approach. In this approach, attempts are made to analyze the behavior of the disabled child after establishing very good rapport with then child, and find out the root cause of learning disorder. Accordingly, a remedial program is planned and administered to the child to overcome the problem. Individualized instructional approach. This technique of counseling advocates the use of small groups or even individuals for helping them to rectify their learning deficiencies. Peer tutoring has proved to be a successful technique for providing individual assistance to the affected children. The child feels quite safe and secure, and in this atmosphere, with the help of the peer, the child is able to come up to a satisfactory learning level. Self-instructional approach. In this approach, the counselor helps the children by making them realize the concept of self-learning and self-improvement measures. For this purpose, remedial programs are presented in the form of program learning text, computer-assisted instructions, etc. One can also include self-learning questionnaire and instructional module specially prepared for this purpose and put to use by the counselor with the help of the teacher. For better output, these programs should be guided by the counselor. Multisensory approach. In this type of counseling, the counselor helps the LD children to use their multiple senses, e.g. visual, touch, auditory, etc. depending upon the nature of subject material and its learning objective, e.g. to provide wholesome languages experiences. A multisensory approach, VAKTIE visual, auditory, kinesthetic and tactile, has been devised. While counseling, the counselor must remember to use step-by-step method, where the children are first acquainted with the letters of words and then slowly with the word. Once the word is mastered, the learner is asked to make use of it in a sentence, then into a story writing. After that, they are finally provided reading practices. Technological approach. In this approach, the counselor can make use of advanced technology for providing remedial instructional program. In this type of remedial instruction, visual and auditory presentation are made by which the children can watch useful and interesting social and academic presentation on the video disc. At the same time, they listen to the narration with useful instructions. Audio tape recorder. Reading, speaking and conversation skills can be better developed within the child with the help of the tape recorder. The counselor is able to rectify many of languages learning difficulty, especially related to the pronunciation and way of speaking. Computer-assisted instructions, CAI. Severe LD cases find it difficult to follow classroom teaching and textbook. For them, hypertext technology and hypermedia technology are used and provision for using computer and computer technology is given. Additional help to the LD children, particularly in severe cases, the counselor can provide the certifications of LD and help them use computer while appearing in examination. In this way, the advanced technology can be utilized for providing useful remedial measures to the learning disabled problems. 4.4 Attention Deficit Hyperactivity Disorder, ADHD. This is another common problem seen in the childhood, as 5% to 7% of the school-age children suffer from the ADHD, Goldman et al. ADHD, often referred to as hyperactivity, is characterized by difficulties that interfere with effective task-oriented behavior in the children, particularly impulsivity, excessive motor activity, and difficulties in sustaining attention. The prevalence of ADHD is much among the boys than of the girls, 6 to 9 times more. ADHD occurs with the greatest frequency before the age of 8 or 9.
4.4.1 Symptoms of ADHD. The counselor must see the following symptoms in the client before deciding that the child suffers from ADHD. ADHD hyperactive children show excessive or exaggerated muscular activity, such as aimless or haphazard running or fidgeting, difficulty in sustaining attention, highly distractible and fail to follow instructions, do not respond to the demands placed on them, impulsive behavior, low frustration tolerance, sometimes low IQ, below average, but not always. At times they are socially intrusive, have great difficulty in getting along with their parents because they do not obey rules, do not appear to be anxious, commonly show specific learning disabilities as they are poor in academics. Pose behavioral problems in elementary grades classes. 4.4.2 Casual factors in ADHD. At present, the causes for ADHD are not known, but probable causes of ADHD may be environment, biological, genetic, or social. Many psychologists consider the biological factor as the genetic inheritance to be the cause of developing ADHD. Hyperactivity in children may be produced by dietary factors such as food colorings, food addictive, food adulteration, preservatives, etc. Due to such foods, hyperactivity increases because of the extra energy consumed by the children in form of chocolate, candy, fast food, etc. The psychological causes of hyperactivity are based on the temperament and learning factors in addition to family pathogens, prenatal problems leading to hyperactivity in children. 4.4.3 Techniques for helping the ADHD children. Most common treatment is the use of drug that stimulates the central nervous system. In ADHD, the counseling techniques used are more or less the same as the ones used in learning disability. In ADHD, these counseling techniques are used along with medications. Psychosocial approaches of counseling may also be used. The medication is seen effective only when it is combined with behavior modification, parental training, etc., and has been found to be more effective in changing the social behavior of ADHD. Pelham 1993. Counseling the parent of child and involving them in the treatment plan and behavioral aspect of the treatment are extremely important. It is a duty of the counselor that, after diagnosing the problem, correct information about the disorder should be given to parents' caretaker, which should include its neutral course, positive cases, prognosis, with and without treatment. They should also be given practical suggestions for the daily management of their child, e.g., parents must learn the importance of avoiding stressful situation known to cause difficulty and excessive fatigue. During the parental counseling, the parents can be taught the general principle of structuring the child's environment to include regular routine and proper limits set on the child behavior according to the need. And if the counselor feels that family counseling is required, then the same should be taken up with the family members. Such family counseling may help because family therapy is an umbrella where whole family is the unit by which ADHD child in the family can be treated. In addition, the counselor must focus on the behavior therapies counseling, which includes social modeling and imitation, social management, social support, self-instructions, self-praise and behavior contract. Apart from this, if required, integrative counseling technique can be used by the counselor. Moreover, medication and yoga has been demonstrated to be extremely effective in treating ADHD. 4.5 Anxiety disorder. Most children are vulnerable to fear and uncertainty as a normal part of growing up. It is seen that children with anxiety disorder are more extreme in behavior than those experiencing normal anxiety. These children show certain characteristics such as shyness, timidity, unrealistic fears, phobia for school, overdependency on others for support and help, sleep disturbances, feeling of inadequacy, hypersensitivity, etc. Psychological treatments for child anxiety range from simple self-management techniques to therapies that are more complex. Administering medication as a management tool can enhance psychological treatment and can prevent or control severe instances of anxiety. The type of therapy needed largely depends on the intensity and frequency of the child's anxiety. Anxiety disorder is very common in childhood as noticed by Dads et al. 1997. In fact, 9.7% of one community-based school clearly met the diagnostic criteria for an anxiety-based disorder. Two additional anxiety-based disorders are A. Separation anxiety. As the name suggests, it is a disorder in children which is most common in childhood as the prevalence rate is very high. The symptoms seen in the children with separation anxiety disorder are lack of confidence, apprehensive in new situation, tend to be immature for their age, oversensitive, nervous, easily and frequently moved to tears, overly dependent. The essential feature is excessive anxiety about separation from attachment figures, such as mother, father, etc. This kind of disorder is common in girls, though it is not very stable in children. Recovery is seen faster. Some children go on to exhibit school for refusal problem, i.e. fear of leaving home and parents to attain school, and continues to have adjustment difficulty in life if it is untreated. B. Selective mutism. This is a kind of anxiety disorder where the child is unable to speak in a specific social situation. Example, in school or in social groups. These children are unable to understand and adjust within their class society. This disorder can only be diagnosed if the child has the ability to speak, and such condition should be persistently seen for 1 month because in initial days of schooling, many children do show these symptoms. Mutism is very rarely seen in children. This disorder is common in all social strata, and the main symptom is failure to speak in particular social situation, mainly in school. Causes of mutism. Amongst the various causes for selective mutism, the following are the main ones: biological genetic factors and environment setting. The typical symptoms in anxiety disorder which the counselor should know before counseling therapy are as follows: easily upset by even small disappointments, manifesting unusual constitutional sensitivity. The learning factors which have negative influence on the mind of the children, e.g. illness, accidents, experiences such as hospitalization. Modeling effect of an over-anxious and protective parent can also develop anxiety in children. Lack of confidence is obtained amongst these children. Thus, the role of social environmental factors also plays an important role in the onset of anxiety disorder in the children. Repeated experiences of failure, indifferent or detached parents also foster anxiety in their children. Researchers have also shown the threatening situation which is also a cause of withdrawal. Early childhood experiences also play an important role in causing anxiety disorder. 4.5.1 Techniques for helping children with anxiety disorder. The counselor, while treating anxiety disorder in children, should assess the kind of anxiety which the child is having, after which process only the counselor can provide the best counseling services and will be able to get maximum cooperation from the client and also benefit the client maximally. A child is never too young or too old for an anxiety diagnosis. If left untreated, the anxiety may worsen and eventually spill over into adulthood, resulting in a life with problems. In an attempt to escape the unpleasant feelings, the over-anxious child will often turn to experimentation with drugs or alcohol. Anxiety can be specific, such as due to separation from a loved one, or more basic, such as the generalized anxiety disorder. Each type of child anxiety requires a distinct psychological treatment that includes a combination of therapies, medicines, play, therapy, psychotherapy, behavior therapy, and so on. A child that knows how to identify and handle times of stress has a better chance of tackling the anxiety before it gets out of control. Self-management tools teach a child how to recognize anxiety triggers so that the child completes prevention or control without any outside assistance. Knowing what causes the anxiety is necessary for self-management. If the stressor is unavoidable, the child learns how to adapt and handle his or her reaction to the situation prior to it occurring. This tool emphasizes control and reinforces confidence. Relaxation techniques. Taking deep breaths through the nose has a calming effect on the child. Being able to relax and calm down during an anxious situation significantly reduces or eliminates the adverse reaction. The best relaxation techniques focus on breathing. Breathing increases the supply of oxygen to the brain and naturally reduces stress. Focusing on the breathing creates a distraction for the child that further decreases stress. Coaching a child to inflate and deflate the balloon in their belly is one way to make deep breathing fun. That is also simple. Sending the breath on an elevator ride starting in the nose, traveling through the body and arriving at the toes is an imaginative anxiety-relieving exercise. Cognitive behavioral therapy. Cognitive behavioral therapy has the ability to transform an anxious child to a calm one. Cognitive behavioral therapy focuses on educating the child regarding the inappropriateness of their behavior. Using a story or role play to act out the scenario is an ideal example of how to use cognitive behavioral therapy to help children modify their reactions. Since fear is a large component of anxiety, a lack of education can also be a cause for concern. Little to no information about the topic or situation creates an increased fear and anxiety potential.
This naturally decreases if the child possesses a full understanding of the stress learned through therapy methods. Psychotherapy provides opportunity for the successful conquering of anxiety. Counseling the child regularly is a popular method of dealing with anxiety. Addressing the particular aspect of the anxiety that causes the most stress can help the child overcome it. Encouraging talk reveals underlying causes of stress and anxiety and provides an outlet for the child to release fears. If there is a specific cause for anxiety, psychotherapy can tackle it through exposure. Slowly having the child encounter his fear can bring about a dismissal of it. While it initially may seem to aggravate it, in the end the anxiety can be overcome. If the fear is intense, therapists may first simulate the cause of the fear using a computer or pictures. Eventually the child will be able to deal with the real thing. Psychiatric evaluation medication may be necessary if standard psychological treatments are not completely effective. If psychological treatments for child anxiety do not completely address the problem, medication may be helpful. Depending on the severity and complications caused by the child's anxiety, medication may or may not be necessary. The psychologist can refer the child to a psychiatrist who specializes in the specific type of anxiety. While a psychologist can identify the possible need for medication, only a licensed psychiatrist can evaluate the situation and administer the proper drugs. As affected child have wider interaction in the school, so with the help of school counselor, peer group activity should be taken up by which the children are able to overcome their anxiety. The counselor should also take the help of other teachers who are aware of the need of the anxious children. This would help the counselor to have effective counseling session according to the need of the child concerned. The most commonly used counseling is based on behavior modification. Behavior therapy has many techniques and the most appropriate technique is used by the counselor depending on the need of the child as given below. 4.5.2 To provide help with mastering essentials, competency, systematic desensitization and in vivo desensitization, that is using real-life situations graded in terms of anxiety-arousing stimuli. A counselor can also use cognitive behavior therapy with behavior therapy, because once the beliefs and thoughts are identified, then it is easier for the counselor to treat the child. While treating the negative thinking of the child, the counselor must identify automatic thoughts of negativity in the child. Then the counselor helps the child not to blame oneself, and counseling involves shifting the focus or attention on the thoughts from self to the other aspects in the situation. The counselor helps the child in searching of alternative solutions to the problem where he or she can take the help of teacher, parents, peers, etc. Cognitive rehearsal is also used in this treatment. The child or the client is given practice to visualize and imagine each successive step leading to the completion of the task, such as talking to someone, working hard at study, etc., so the potential obstacles can be identified, anticipated, and changed. Parental counseling and family counseling, if required, can be provided. 4.6 Behavioral disorders of childhood and adolescence. 4.6.1 Sleepwalk. Sleepwalk is also termed as somnambulism. It is a disorder in which the children leave their bed and walk around without being conscious of the experience or remembering it later. Onset of sleepwalk is usually between the ages of 6 to 12 years, and according to DSM-IV, its prevalence is between 10% to 30%. In this disorder, children go to sleep in a normal manner, but during the second or third hour of sleep, they may walk in the room or in other rooms or even outside of their house. They can also be engaged in complex activities like eating food, playing with toys, but finally return to bed, but in the morning they do not remember anything. Children while walking during sleep may fully open their eyes during walk or partially open their eyes. This episode lasts for 15 to 30 minutes. The cause is clearly not known, but it takes place during non-rapid eye movement, NREM, sleep. According to the researchers, sleepwalk is related to some anxiety-arousing situations that has just occurred or is expected to occur in the near future.
During counseling, the counselor can use behavioral therapy with the client as explained above. The assessment data of neurological and medical reports should also be considered along with behavior therapy. The other techniques which the counselor can use for treatment are as given below. Telling the parents to wash the face with cold water and make sure that the child is fully awakened, finding out if the child is having dream nightmare, and if it is nightmare, the type of nightmare that the child experiences, assertive training including integrative approach of counseling along with interpretation of dream can be useful. 4.6.2 Tics. Tic is a muscular twist or a spasm related to muscle. It can be blinking of eyes, licking the lip, twisting the neck, blowing the nose, clearing the throat, twisting mouth, etc. It occurs generally between the ages of 2 to 14 years. It is more common in boys than in girls. The treatments for such anxiety-related issue are behavior intervention, relaxation technique, awareness technique, cognitive technique. Yoga is also helpful in treating such clients. 4.6.3 Functional enuresis encopresis. It refers to involuntary habitual discharge of urine at night even after age of 5 years. It is also called bedwetting. The counselor must notice that it may be because of the child is under stress or is unduly tired. It can also be a result of various organic conditions such as disturbed cerebral control of bladder, side effect due to medicines, or neurological dysfunction. The causes can be personal immaturity, emotional problems, faulty learning, disturbed family interaction, hostility and anxiety. While counseling conditioning procedures, if used by the counselor, are most effective, parental counseling, learning-based procedures are most effective if required. The case can also be referred for medical treatment as well with counseling. The same kind of treatment may also be used for the children who have not learned appropriate toileting for bowel movement after age of 4 years, which is named as functional encopresis. 4.7 Autism spectrum disorder, ASD. Autism is a PDD, pervasive development disorder. These disorders are considered to be the result of some structural differences in the brain that are usually evident at birth or become apparent as the child begins to develop. Autism is a development disorder which involves wide range of problematic behavior. This includes defect in language, perception, motor development not related to reality and social situations. Sometimes intellectual ability is also hindered as there is impairment on memory as well. 4.7.1 Causes of autism spectrum disorder. Scientists are not certain about what causes ASD, but it is likely that both genetics and environment play a role. Researchers have identified a number of genes associated with the disorder. Studies of people with ASD have found irregularities in several regions of the brain. Other studies suggest that people with ASD have abnormal levels of serotonin or other neurotransmitters in the brain. These abnormalities suggest that ASD could result from the disruption of normal brain development early in fetal development caused by defects in genes that control brain growth and that regulate how brain cells communicate with each other, possibly due to the influence of environmental factors on gene function. Twin and family studies strongly suggest that some people have a genetic predisposition to autism. Identical twin studies show that if one twin is affected, there is up to a 90% chance the other twin will be affected. There are a number of studies in progress to determine the specific genetic factors associated with the development of ASD. In families with one child with ASD, the risk of having a second child with the disorder is approximately 5% or 1 in 20. This is greater than the risk for the general population. Researchers are looking for clues about which genes contribute to this increased susceptibility. 4.7.2 Techniques for helping children with ASD. The counselor can provide following method of counseling. Help the client in mastering the fundamentals of social behavior, development of some language skills. Behavioral counseling, parental counseling, training children to do their own work, engaging the child in various activities, behavior modification techniques, etc. The first dimension of parenting behavior is the parental acceptance and warmth, which appear to influence the degree to which the children internalize the standard and expectations of their parent. Eccles et al. 1997. It should be noted by the counselors that children whose parents do not hold them in high regard they develop low self-esteem and low self-control and suffer from many anxiety disorders and other emotional and behavioral problems. The second dimension of parenting behavior is parental strictness and parental standards. The absence of control is associated with maladjustment and high level of aggression. Where parents are moderately controlling and sets up a high performance standard and expects increasingly mature behavior from children are bound to have children showing high aggression. Therefore, the counselor during parental counseling must make it clear to the parent about their parenting style and how it adversely affects the development of child's behavior. The counseling must focus on helping parents to use permissible parenting style, that is, acceptance and low control. They should stay alert for good behavior and reward it and reinforce rules consistently. Moreover, the counselor should make it clear to the teachers, parents, caretakers, family members, etc., that punishment should not damage the child's self-esteem. The punishment should be swift and consistent. If the child is punished, she should be explain the reason for punishment. The best strategy is to punish an undesirable response and reward the positive alternative behavior. For example, many troublesome behaviors in children may take the form of attention-seeking. Punishment of these responses will be more effective if parents and teachers provide the child with more acceptable ways to gain attention. 4.8 General counseling techniques. Children have their own ideas and personalities. Counseling can be as difficult for children as it is in the case of adults. Sometimes even more difficult. No matter what the purpose is, it is important to remember that communication with children is not the same as it is with adults. There are varieties of counseling techniques to use with children. 4.8.1 Defining their world. Counseling can be difficult for children because of the implicit difficulty with being a child and relating to an adult, especially an adult that they do not know. It is important to start therapy with a child by understanding his/her viewpoint. Instead of starting a conversation with assumptions, lead by asking a question in their language. As rapport continues to build or as the child becomes more comfortable, he will begin to relate the question to how he feels and offer more of an explanation about his personal situation. 4.8.2 Sharing their world. Role play is a conventional technique and can be extremely effective and revealing. Depending on the child's age, it may be more conducive to ask him to help you write play about what it is like at home to better understand him. Ask the child to play the role of one parent while you play the role of the other. They can help you write the script by describing what their mommy or daddy would typically say. Observe any emotion in the delivery of lines in the play. 4.8.3 Showing their world. Art therapy can be an incredibly effective form of counseling with children. Although it is helpful, one does not have to be a certified art therapist to use art therapy in counseling. Most children are interested to draw or do some work of art, and it can be a nice distraction in a situation where they are not comfortable verbally communicating how they feel. Start by asking the child to draw a picture that shows what his day is like from the time he wakes up to the time he goes to bed. Observe any differences between the time he is at home and the time he is outside of the home or at school. If the child seems resistant, sit down with him and offer to do the same with the promise that you will share your picture too. 4.8.4 Play therapy. A play therapist, much like any other mental health professional, sees patients mostly one-on-one in 30 to 50-minute sessions. The Association for Play Therapy estimates that it takes about 20 sessions to address a child's problems, but some children may require more or fewer sessions. A play therapist spends time with each child and, sometimes in sessions with the child's family. She uses specific play techniques to help the children address behavioral, learning, emotional, and social problems. In some cases, these problems arise from environmental stresses such as divorce, natural disasters, domestic violence, death, or war. 4.9 Counseling middle school students. Middle school students are prime candidates for understanding their strengths and weaknesses and their relationship with their learning environment. As such, self-directed cognitive strategies can improve academic performance and school attendance and decrease tardiness. 4.9.1 Adolescent development. As children move towards independence in adolescence, they demonstrate improved abilities to express themselves, begin to think about their future more, and are able to deal more with abstract thought. Depending on the individual student's development, he or she may engage in more sophisticated information processing strategies and can reflect on complicated problems. Middle school students also tend to return to childish behaviors and can exhibit more self-doubt and frustration.
The strengths of development can be directed to offset the weaknesses, and mentoring, counseling, and strong role models are often effectively focused to assist the student with the sometimes confusing and distracting world of middle school. 4.9.2 Counseling strategies. Counseling options for middle school students can engage all of the cognitive processes: memory, convergence, divergence, and evaluation. Students can be prompted to rely more on their memories to define, identify, and designate. Convergent thinking asks the student to consider explanations, relationships, and comparisons. Divergent thinking predicts, hypothesizes, infers, and reconstructs. Evaluative thinking judges, defends, and justifies choices. Using memory, a counselor can prompt the student to identify classroom expectations and standards, social norms, and personal goals. The student uses her convergent skills in explaining why these standards are applicable to her, how her goals are important to her, her family, and peers, and can compare and contrast her feelings and ideas with those of others. The counselor can prompt the student with if, then scenarios and hypothetical situations to develop divergent thinking skills. Finally, the counselor may ask the student his opinion of another's actions or words, and then his own, then justify behavior based on opinion and precedent. The counselor can also consider motivation as a cognitive process. Motivational enhancement therapy focuses on enhancing adolescents' academic motivation. Counselors meet with students and help them focus and be aware of the motivational issues they face rather than denying them. Counselors also assist the students to develop lasting strategies to maintain their motivation and achievement. Motivators can include goal achievement, competition, self-esteem and self-efficacy, and positive social standards. The great strength of adolescence is that it is the door to independent living. Middle school students are developing independent thought processes and can be counseled to use these cognitions to benefit their development and growth. Counselors who successfully use cognitive strategies with their students find the student engaged and often receptive to the increased responsibility. 4.10 Other counseling techniques. The counselor can also help the children by the following counseling techniques. Filled circle, helping the children to assess their own motives in self-improvement. Filled circle, helping the children in developing self-efficacy. Filled circle, assisting them in overcoming self-defeating behavior. Filled circle, assisting them in self-monitoring. 4.10.1 Self-assessment. The counselor helps the clients, especially children who are more than age of 7, to assess their own motives. It will reflect on truthful information about themselves, and they can self-verify where the problem is, and self-improvement is seen in the children, and they will develop a positive feeling for themselves. The only task of the counselor here is to provoke the client about his/her past immediate experiences. 4.10.2 Self-efficacy. Self-efficacy is the people's convictions that they can achieve specific goals. The counselor assesses the client to build up self-efficacy, which also varies according to the children's skills, e.g. a child may have high self-efficacy when it comes to making friends but low self-efficacy when it comes to speaking in front of groups or large audience. So self-efficacy is concerned not with skills the child has but with his/her belief about what he can do with the skills. Therefore the counselor's attention must be such that making the child believe, I think I can, etc. In this manner the counselor can help children in 4 different ways as stated by Bandura 2000. 1. Mastering experiences. Mastering new skill can reduce the problem of the child and encourage the children to learn from their own mistakes. This approach provides children with mastering experiences they need to build self-efficacy and approach future challenges with confidence. 2. Vicarious experiences. The counselor helps the child to improve self-efficacy by watching others perform a skill that he/she wants to learn, e.g. choosing a model figure and bringing changes in oneself by watching. 3. Persuasion and encouragement. If the child is encouraged and rewards are given on the smallest steps that they take towards mastering a skill, then one can see the changes in their behavior. This will help them to become successful. 4. Interpretation of emotional arousal. If the child is suffering from anxiety disorder, then there are chances of some symptoms related to physiological changes can also be seen. So the counselor helps the client to bring alternatives to do well and boost the child in believing that he/she will get success.
4.10.3 Self-defeating behavior. Children suffering from anxiety disorder generally show self-defeating behaviors, which are of 3 categories as given by Roy Baumeister, 1997. Let us take these one by one. 1. Deliberate self-destruction. Children want to harm themselves. 2. Trade-offs. It is seen in the form overeating, stress, emotional distress, shyness, etc. 3. Counterproductivity. Children show unproductive behavior by being attached to one thing only. This type of behavior is mostly seen in children who have emotional problem. Therefore, the counselor must help and assist children by using client-centered approach where unconditional positive regard is given and importance is given to oneself. 4.10.4 Self-monitoring. The counselor holds the client to control the negative attitude impression the children make on others. Clients who are high self-monitors seem to be very sensitive to their impact on others. Mark Snyder, 1986, 2000. Low self-monitor, on the other hand, are less concerned about impression management and behavior. Therefore, low self-monitor sees themselves as having the strong principles and behaving in line with them, whereas high self-monitors perceive themselves as flexible and pragmatic. So, the counselor helps to moderate self-monitoring building within the clients by which high adjustment is seen and proper self-efficacy is built up. These techniques can be useful if children are able to recognize their self-image by learning more about themselves. Try to set their goals that are reachable, that is, the goals should be short-term, reachable, and the counselor must help the children to recognize their goals and help the children to emphasize on their strength by which the children will think positively and their emotions will be stable, which will enhance their personality. 4.11 Summary. In this unit we have been dealing with the topic of counseling children. We started with the various disorders children suffer from, such as the learning disability, attention deficit hyperactivity disorder, anxiety disorder, etc. We also delineated the causes of these disorders, nature, cause, symptoms and treatment of these disorders. We also discussed the techniques of counseling that are suited to children suffering from the different disorders. We then discussed the autism spectrum disorder, delineated the causes and pointed out the various techniques of counseling that would help in these cases. Then we discussed the general counseling techniques and pointed out the problems faced by children in middle schools and the strategies one should use to help these children. Other techniques discussed included self-monitoring, self-efficiency and self-defeating behaviors. Thank you. Subscribe to our channel for more updates, and we will see you with the next chapter.